muscle of the thoracic wall. First one we have intercostalis externi. Origin, lower border of ribs. Insertion, upper border of rib below. Action, inspiration, or draw the ribs together so as they enlarge the thoracic cavity. Innervation, intercostal nerves. Levator costarum. Origin, transverse process of C7 to T12 vertebrae. Insertion, superior surface of the ribs immediately inferior to preceding vertebrae. Action, assist in elevation of the thoracic rib cage. Innervation, dorsal rami C8 T2 to T11. Next, intercostalis interni. Origin, lower border of ribs. Insertion, upper border of ribs. Action, draw the ribs together so as they narrow the thoracic cavity. Innervation, muscular branches of intercostal nerves. Subcostalis. Origin, beneath the internal intercostal muscle at the vertebral ends of the ribs. Insertion, bridges several ribs. Action, draws the rib together. Innervation, intercostal. Less. Next, rectus thoracis. Origin, first rib opposite the most ventral portion of the scalenus muscle. Insertion, ventral ends of the second to fourth ribs. Action, inspiration. Innervation, lateral branch of the intercostalis. Next, transversus thoracis. Origin, dorsolateral surface of the sternum from the second sternebra to the caudal end of the xiphoid process. Insertion, second to seventh costal cartilage, somewhat ventral to the costochondral articulation. Action, contributes to expiration. Innervation, intercostal nerves. Retractor costae. Origin, transverse process of the first 3 or 4 lumbar vertebrae attached to the thoracolumbar fascia. Insertion, last rib. Action, draw the last rib caudally, aiding in the expiration, and innervation, last thoracic nerve.
For the muscles of the abdominal wall, first we have the obliquus abdominis externus or the external abdominal oblique. Nag-originate siya from the last few pairs of rib and it inserts to the pubic symphysis and xiphoid process or simply the abdominal wall. Its action is for abdominal press such as expiration, urination, defecation, and parturition. And its innervation is the last 8 or 9 intercostales or the thoracic spinal, iliohypogastric, and the ilioinguinalis nerve. Next, we have the obliquus internus abdominis or the internal abdominal oblique. Nag-originate siya sa tubercoccae and it inserts to the last 2 ribs or last 13th rib and the cartilage of the 12th rib. Its action is compression and support of the abdominal viscera for, kagaya kanina, is expiration, defecation, urination, and parturition. Kanyang innervation, similar din kay external abdominal oblique. We have the thoracic spinal, iliohypogastric, and ilioinguinalis nerves. The transversus abdominis naman, nag-originate siya sa 8 costal cartilage at lumbar vertebra. Nag-insert siya sa inner surface of the rectus abdominus or the linea alba. Its action, pareho lang din kay internal abdominal oblique. Kanyang innervation din is also the same. Next, we have the rectus abdominis. The rectus abdominis originates from the sternum and costal cartilage. Nag-insert siya sa costal cartilage hanggang sa pecten of the pubis. Its action is also the same sa mga previous muscles kanina. Abdominal press such as expiration, urination, defecation, and parturition. Its innervation is also the same. Also, we have the cutaneous trunci. Si cutaneous trunci nag-originate sa gluteal area or the superficial gluteal fascia. It inserts to the axillary region and its action is for protective mechanism and reflex. Kanyang innervation naman is efferent supply, lateral thoracic nerve, or simply the cervical and thoracic spinal nerve. Sunod, we have the preputialis. The preputialis originate from the xiphoid cartilage of the rib. It inserts to the dorsal wall of the prepuce. At ang kanyang action is for prevention ng paghang loosely ng skin ng prepuce, especially when non-erected yung penis ng dog. Kanyang innervation naman is lateral thoracic nerve. And last, for the muscles of the abdominal wall, we have the supramamaricus. The supramamaricus originate from the region around the last rib and lumbar vertebra. It inserts to the mammary gland area and its action is to support the mammary glands at ang pag-assist ng movement ng skin. Its innervation is the lateral branches of the thoracic and lumbar spinal nerve.
Sacrocaudalis dorsalis lateralis. Origin, continuation of the longissimus, fleshy from the aponeurosis of the longissimus and the tendinous. Origin from the mammillary processes of the first to 6 lumbar vertebra. The articular processes of the sacrum and the mammillary processes of at least the first 8 caudal vertebrae. Insertion, mammillary process of the 5th to last caudal vertebrae. Action, extension or lifting of the tail, possibly also to move it to one side. And innervation, branches of the plexus caudalis dorsalis. Sacrocaudalis dorsalis medialis. Origin, small processes that are dorsolateral to the caudal edge of the caudal vertebrae. Direct extension of the multifidus muscle. Insertion, mammillary processes of the 5th to last caudal vertebrae. Action, extension of the tail or lateral flexion. Innervation, branches of the plexus caudalis dorsalis. Sacro dorsalis ventralis lateralis. Origin, ventral surface of the body of the last lumbar vertebra and from the sacrum. The remainder arise from the ventral surfaces and roots of the transverse processes of the caudal vertebrae. Insertion, mammillary processes of the 5th through last caudal vertebrae. Action, ventral lateral tubercle of the proximal end of the 6th through last caudal vertebrae. Innervation, branches of the plexus caudalis ventralis. Sacrocaudalis ventralis medialis. Origin, starting from the last sacral vertebrae on the ventral surface and running from each vertebra to the next. Insertion, ventrolateral process of each vertebra. Action, flexion of the tail and occasionally lateral movement. Innervation, branches of the plexus caudalis ventralis. Intertransversarius dorsalis caudae. Origin, transverse process of the caudal vertebrae. Insertion, transverse process of the adjacent caudal vertebrae. Action, lateral flexion and stabilization of the tail. Innervation, caudal spinal nerves.
As for the intertransversarius ventralis caudae, its origin is the ventral aspect of the transverse process of the caudal vertebrae ribs. Its insertion is on the ventral aspect of the transverse process of the adjacent caudal vertebrae, and its action is the lateral flexion of the tail, while its innervation is the branches of the plexus caudalis ventralis. For the coccygeus, its origin is the ischiatic spine. Its insertion is the transverse processes of the 2nd to 5th caudal vertebrae, and its action is bilateral, so to press the tail against the anus and genital parts, and in conjunction with the depressors to draw the tail between the pelvic limbs, while for the unilateral part, it's for lateral flexion. So the innervation would be the ventral branches of the 3rd sacral nerve. For iliocaudales, the origin would be the medial edge of the shaft of the ilium. Its insertion would be the tendon attaches to the hemo process of the 7th caudal vertebra, and it also passes into the caudal fascia. Its innervation would be the ventral branches of the 3rd or last sacral and the 1st caudal nerve. Its action on the bilateral part would be to press the tail against the anus and genital parts. In the unilateral part, it is to bring the tail cranially and laterally. The levatores ani muscles, in combination with the levators of the tail, cause the sharp angulation between the 6th and 7th caudal vertebra, which is characteristic for defecation, compression of the rectum. For iliocaudales, the origin would be the medial edge of the shaft of the ilium. Its insertion would be the tendon attaches to the hemo process of the 7th caudal vertebra, and it also passes into the caudal fascia. Its innervation would be the ventral branches of the 3rd or last sacral and the 1st caudal nerve. Its action on the bilateral part would be to press the tail against the anus and genital parts. In the unilateral part, it is to bring the tail cranially and laterally. The levatores ani muscles, in combination with the levators of the tail, causes sharp angulation between the 6th and 7th caudal vertebra, which is characteristic for defecation, compression of the rectum. As for the rectococcygeus, its origin would be the external longitudinal musculature of the rectum, and its insertion would be caudodorsally from the sides of the rectum and pass through the fascial arc formed by the attachment of the external anal sphincter to the fascia of the tail. Its action is to aid in defecation, while its innervation is some autonomic fibers from pelvic plexus. And the sphincter ani internus's origin would be caudal, thickened portion of the circular coat of the anal canal. The insertion would be between the two sphincter muscles. On either side lies the perineal sinus. And the action would be to help the external end sphincter to occlude the anal aperture and aid in the expulsion of the feces. Its innervation would be the pudendal nerve. And then the ani externus, it's located on the skin and fascia surrounding the anus. The insertion would be the perineal body and anococcygeal ligament, and its action is to keep the anal canal and the anus closed. It's in the expulsion of the feces as well. Its innervation would be the inferior anal branch of pudendal nerve, or sacral 2 to sacral 4. Lastly, the retractor penis or clitoridis, it originates or arises ventrally on each side of the sacrum or first two caudal vertebrae. Its insertion would be the external sphincter, and its action would be that it retracts and contracts movement of the tail. Innervation would be the caudal nerve.